What if I told you that the medication you trust the most could be quietly affecting your brain? Not instantly, not in a way you would notice, but slowly, over time, and you would never feel it happening. No pain, no warning, no alarm, just small changes you start to ignore, forgetting words, slower thinking, losing focus more often. And here's what most people don't realize. It is not rare, it is not expensive, and it is not hidden. It might already be in your home, and you may have taken it recently without even thinking about it. Stay with me, because by the end of this video, you will understand what it's doing to your brain and how to protect it for life. Before we begin, let me make something very clear. This video is not about fear. It is about awareness, and awareness without panic is power. I am Dr. Alric Stone. I have spent nearly 3 decades in clinical medicine, working directly with patients dealing with chronic illness, aging, and neurological decline. And if there is one pattern I have learned, it is this. Most people are never told the full long-term picture of their medications, not because doctors hide it, but because in a 10-minute consultation, long-term cognitive risk is rarely discussed. Today, we change that. Let me tell you about Margaret again, but in a deeper way. Margaret did not become forgetful overnight. There was no single moment of collapse. Instead, it was gradual. First, she stopped remembering small appointments. Then, she started repeating questions. Then, she began losing emotional connection to familiar things. And here is the important part. Her family assumed it was normal aging. Even she believed it, because nothing felt wrong enough to alarm her. But inside the brain, something else was happening. Neural communication slowing down, memory retrieval becoming less efficient, cognitive pathways weakening, and by the time clinical diagnosis becomes obvious, the underlying process has often been active for years. Now here is what most people do not understand. The brain does not fail suddenly. It degrades gradually, like software slowing down over time, not crashing all at once. And certain medications do not directly damage the brain immediately, but they influence the chemistry that keeps it functioning optimally. That is the key difference. And today, I will show you 7 such medications, not as a warning, but as a guide for informed decision-making. Sleeping pills are designed to force sedation. They do not replicate natural sleep cycles. They chemically suppress brain activity. Now, short-term use in acute insomnia can be appropriate, but long-term use introduces a pattern. The brain stops producing natural sleep regulation efficiently. Sleep architecture becomes disrupted, and cognitive restoration during sleep decreases. Over time, this can contribute to memory fragmentation, reduced attention span, morning cognitive fog, and importantly, the risk increases significantly in older adults whose brain resilience is already declining naturally. This is why physicians recommend shortest duration possible, with regular reassessment. And antihistamines like diphenhydramine cross the blood-brain barrier. This is critical because once inside the brain, they do not only reduce allergy symptoms, they interfere with neurotransmitters involved in cognition, specifically acetylcholine. Now, acetylcholine is not a minor chemical. It is essential for attention, learning, memory encoding. Chronic suppression of this system is associated in multiple observational studies with increased cognitive decline risk, especially when combined with other anticholinergic drugs. Oh, Bladder medications are often overlooked because their purpose seems unrelated to cognition, but neurologically, they act on the same acetylcholine system. Now imagine 2 or more medications, all reducing the same neurotransmitter. Over years, this creates a cumulative anticholinergic burden, and research suggests higher cumulative burden correlates with higher dementia risk scores. This is why medication review is not optional in long-term care. It is essential. At this point, you might think the issue is individual drugs, but clinically, that is not the full picture. The real issue is polypharmacy, multiple medications interacting over long time periods without periodic reassessment. The brain is not exposed to one drug. It is exposed to combinations, and those combinations change brain chemistry in ways that are not always predictable. This is why annual medication reviews are critical after age 50. These medications enhance GABA activity, which slows brain signaling. Short-term, this reduces anxiety. Long-term, it reduces neural responsiveness. The brain adapts by downregulating its own calming mechanisms. This leads to dependence, tolerance, and cognitive slowing. Some studies show association with increased dementia risk. But the strongest consensus is this: long-term use should be carefully avoided when possible. Proton pump inhibitors reduce stomach acid. But stomach acid is not just for digestion. It is essential for nutrient absorption, especially vitamin B12, which is crucial for myelin integrity, neuronal function, brain energy metabolism. Deficiency develops slowly, often unnoticed, until neurological symptoms appear. Robert's case is not unique. In fact, I have seen variations of it repeatedly in clinical practice. Patients come in thinking they are simply aging, but detailed review often reveals long-term medication patterns that were never reassessed. And the most painful moment is when they realize some of the decline may have been preventable. Painkillers are complex. They are not inherently dangerous, but chronic unsupervised use is where risk emerges. Some evidence suggests possible vascular effects and indirect impact on cerebral perfusion. However, the strongest clinical concern is not acute toxicity, but long-term overuse without supervision. Now, let's bring this together. Step 1, full medication inventory. Step 2, structured physician review. Step 3, lifestyle-based brain protection, including regular aerobic activity, deep sleep cycles, nutritional adequacy, social cognitive engagement, because brain health is not controlled by one factor. It is a system. Cognitive decline is not a sudden event. It is a long biological process influenced by genetics, environment, and medication exposure. The earlier you identify risk factors, the more control you have over outcomes. That is the real message here. If this video gave you clarity, share it with someone who needs it, because awareness is one of the most powerful forms of prevention. And if you want more evidence-based medical insights, I will see you in the next video. Stay informed, stay aware, and take care of your brain.